Did you know that the Inflation Reduction Act, which was signed into law August 16th of 2022, had major implications on Medicare? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys all about how the Inflation Reduction Act impacts Medicare. Now, some of these changes started to be implemented in 2023, but the majority are going to be rolled out over the next several years. So a quick disclaimer, the Inflation Reduction Act is a very intricate, detailed bill. So I'm doing a very high-level overview of the important things that I think that my clients would want to know about how it impacted Medicare. And the majority of my sourcing is from the Kaiser Family Foundation, who is a nonprofit organization that focuses on journalism and studies relating to major healthcare events. So you could find all my sources and more intricacies about this bill linked in the description below. So how did this bill actually affect Medicare? Well, for starters, in 2023, the first big change is that all insulin on Medicare plans, whether Medicare Advantage or a standalone prescription drug plan, is capped at $35 for a 1-month supply. Now, according to CMS.gov, there are 3.3 million Medicare beneficiaries that are currently on insulin that are going to receive this type of help. So whatever their dose is for a 1-month supply in 2023 is now going to only cost $35 to fill that insulin. And I know from personal experience, working in the industry for 7 years, insulin used to be one of the most expensive and really pain in the butt items for Medicare beneficiaries. So this is going to make a huge impact for seniors and Medicare beneficiaries moving forward. Now, the second part of this bill that took effect in 2023 is that now all Part D vaccines are a $0 copay for Medicare beneficiaries. So the CDC has what's called the Advisory Committee of Immunizations, and that committee sets which vaccines are recommended for people at what ages. So any vaccine on that list is now going to become a $0 copay if it's under Part D of Medicare. So in the year 2020, there were 4.1 million vaccines administered under Part D, of which 3.6 million were for the shingles vaccine, which is commonly known as Shingrix. So all the Medicare beneficiaries who were paying copays for that vaccine now go to a $0 copay. So the Shingrix vaccine, along with all the other ones that are listed by that advisory committee, will now be free for anybody on Medicare. Now, the next big change is being implemented in 2024, and this is for low-income Medicare beneficiaries and their prescription assistants. So what they did was they changed the LIS program, which stands for Limited Income Subsidy, and some refer to it as Extra Help. Now, to understand in full what Extra Help is, I have a completely separate video that goes into that. That's linked in the description below. But basically, anybody as of today, 2023, if you were at 135% of the poverty level or below, your prescription costs are capped, meaning you pay no more than $4.15 for generics and no more than $10.35 for name brands. Now, under the current rules, people that make less than 150% of the federal income poverty level, if they were between 135 and 150, they got what was called a partial subsidy, which truthfully did nothing at all. It really did not help the Medicare beneficiary. So what they did was they said anybody that is below 150% of the federal poverty level will now receive the full subsidy for Extra Help. So those people that were at 140% or 145%, they could still have relatively high copays for medicines. Where now anybody that is below 150%, they're going to have that cap on prescriptions, which again is $4.15 for generics and $10.35 for name brands. But it's also important to note that there is a resource limit involved as well. So you have to be limited in not only income, but also resources to qualify for the Extra Help program. Now, the next big change also takes effect in 2024. And this is actually like two parts to this change. So there is now going to be a cap on prescription spending for all Medicare beneficiaries. So the first cap is to be implemented in 2024. And what this does is any Medicare beneficiary that enters what is called catastrophic coverage, okay? So on Part D plans, there is different levels to go through. You have the deductible stage, you have the initial coverage stage, then you have what's called the coverage gap, also known as the donut hole. Well, when Medicare beneficiaries came out of the coverage gap, they had to pay 5% of the cost of the drug. We're now starting in 2024. Once a Medicare beneficiary comes out of the coverage gap or the donut hole, all their prescriptions go to $0 for the rest of the year. So according to Q1Medicare.com, they estimate that in 2024, people will hit that catastrophic coverage level when they have spent $3,250 on prescriptions. So now when they're in that catastrophic phase, once they have paid $3,250, all prescriptions for the rest of the year will go to a $0 copay. So in 2024, in essence, prescriptions are going to be capped at that number, $3,250. And again, according to Q1Medicare.com, it is estimated that 1.5 million Medicare beneficiaries will hit that threshold. So now instead of them having to pay 5% of the cost of the drug when they're in that stage, everything goes to $0 for the rest of the calendar year. Now, the second cap that has been put into place starts in 2025. And this is a more simple cap where they are saying that if a Medicare beneficiary spends $2,000 on prescription drug costs, all the costs for the remaining of the year go to a $0 copay. So this is a lot more straightforward cap and easier to understand, but that provision doesn't kick in until 2025. So in 2025, any Medicare beneficiary, if they have came out of pocket $2,000 for drugs, everything now will go to $0. Now, I know these numbers are still, relatively outrageous, but if you know people that are on Medicare or that have really specialized drugs, this is actually going to be a huge assistance for them because now they know what to budget for throughout the year. They know that they can't pay more than those caps that are going to start in 2024 and then that more hard cap, which starts in 2025. So the last big change I'm going to tell you guys about is starting in 2026, Medicare is going to have the power to negotiate drug prices with Big Pharma on the most expensive drugs offered to Medicare beneficiaries. Now, this is going to be rolled out in waves. So the actual negotiation process starts this year in 2023. However, we won't actually see those changes implemented until 2026. So starting in 2026, there's going to be 10 of the most expensive drugs that were negotiated. Then in 2027, they're going to add an additional 15. 2028, an additional 15. And 2029, 20 more. So by 2029, there will be 60 of the most expensive drug prices that Medicare will actually be able to negotiate with Big Pharma. And this includes Part D, which is the drugs that you get at your local pharmacy, and also Part B drugs, which are drugs that are normally administered at a clinic or a doctor's office. So the Part D benefit starts in 2026, and then the Part B drugs will kick in 2028. But by the time it's all said and done, there will be 60 total drugs that Medicare will actually have the power to negotiate those drug prices with. Now, it is important to note that there are some exclusions to the negotiations. So Small biotech drugs are going to be excluded from the list, as well as orphan drugs, which are prescriptions that treat rare, very uncommon type of diseases. And there's also going to be an exclusion on prescriptions that just came to the market. Those will not be able to be negotiated either. Now, as I mentioned earlier, these are some highlights of the impacts that are going to be on Medicare. Now, there are some other intricate details that go into this bill, and if you want all of that information, again, all of my sources and all of my articles are going to be attached in the description below. And now, if you're wondering to yourself, well, you don't know what extra help is, or some of these other terms that I went through, well, that's what we're here to help at LMS Insurance Group. We are a full-service, multi-state insurance brokerage that specializes in the senior market. We've been helping Medicare beneficiaries navigate the Medicare maze for 7 years now. With over 135-star reviews, there is nobody that's more equipped to help answer your Medicare questions than me or one of my brokers here at LMS Insurance Group. And of course, there's never a fee for our service. So if you have questions on the Inflation Reduction Act, prescription costs, or anything else Medicare related, be sure to hit that information below via telephone, our website, or email. And of course, don't forget to subscribe to the channel, as that's what helps get this message out to others like yourself that would find it helpful. So thanks for watching. Again, I'm Larry Goist, LMS Insurance Group. We'll talk to you next time. Thanks.